Welcome, everyone, to the Transformation Nurse Academy podcast. This is our weekly episode, Talk with Kevin, where we cover topics for all nursing fields with extra emphasis on emergency and critical nursing. Get ready for candid discussions that explore the vast landscape of nursing and beyond.
All right, welcome, bitches. This is Kevin with the Transformation Nurse Academy podcast. I hope you're doing all right. Another shout out to No Salt BP. Appreciate you. All right, so this week we're going to talk about a 44-year-old female who was dying from necrotizing pancreatitis. She's a 44-year-old Jehovah Witness. She received a blood transfusion during her treatment. So let's talk about blood transfusions first, because if you don't know that a lot of patients who come into the hospital, if they're having surgery, maybe they're anemic, they need a blood transfusion. So what is the normal hemoglobin for a patient? Does anybody know? So for a patient who's a female, the normal hemoglobin is about 12 to 15, and a man is about 13.5 to 17.5. Hemoglobin levels can vary depending on the number of factors. Menstruation, hemoglobin levels are typically lower in women than in men due to iron loss during menstruation. I know I'm not saying that right, Anna, but I'm sure you'll correct me. Older adults tend to have a lower than average hemoglobin level as well. And when you're pregnant people tend to have a lower than average hemoglobin. Hemoglobin levels are measured in grams per deciliter of blood. A blood test can measure hemoglobin levels, and doctors can also measure hemoglobin levels as a part of a complete blood count. A low hemoglobin level in the blood can indicate anemia, a condition which there is a low level of oxygen. Nurse's favorite fucking word, low level of oxygen. So when I first started nursing way back in the day, we would give blood transfusion for people that had a hemoglobin less than 8. Today, when will they get a blood transfusion? It depends on, I guess, the facility and stuff. But like at our facility, we started pushing it down. I think we're down to like 7 now. So every year they keep deciding what they want to change it to. So a hemoglobin level of 7 grams per deciliter is a common threshold for red blood cell transfusions for hospitalized adults who are hemodynamically stable. This includes critically ill patients. If you have cardiac surgery, theirs is about 7.5. Orthopedic surgeries, theirs is about 8. Hematologic and oncologic disorders, how's that, Anna, is less than 7. So it just depends on where you're going, what are you doing, but we're starting to find out that maybe we don't need to be giving people blood as often, and we're panicking a little bit too much, because what is the risk versus the benefit? So when you're giving blood transfusions, though, you want to make sure that you use a Y-site tubing that has a micron filter, right? So if you have a patient that has the need for a blood transfusion, you want to use a Y-site tubing with the micron filter. You can use that tubing for up to 4 hours. So if you have a blood transfusion and you're running it more than 4 hours, something bad is going to happen, most likely. So how long should you run a blood transfusion? Does that make sense? Is 4 hours. So a blood transfusion can take 30 minutes to 4 hours, depending on the type of blood products and the patient's conditions. Red blood cells, a unit of red blood cells, usually takes an hour and a half to 2 hours, but can take up to 4 hours. It shouldn't take more than 4 hours, because the warmer the blood's going to get, the thicker it's going to get. And it's going to cause your patient to have PEs, maybe a stroke, maybe a heart attack. So what kind of solution do you want to use with your Y-site tubing when you're transfusing blood products? 0.9% sodium chloride. I'm going to do a little sponsorship here with Central Valley Medical Education. I want to bring to you Central Valley Medical Education. They offer Heart Code Complete in BLS, ACLS, and PALS or PALS. It is 24/7 access in Fresno and Las Vegas, 7 a.m. to 7 p.m. in Fresno. There's no instructor needed. There's no more classes. It's a 2-year instant certification, and it's for LVNs, RNs, MDs, and any healthcare professionals. Don't forget my RTs out there. I love you, RTs. So you complete the online class. You go to, so once you register at centralvalleycprclasses.com, once you register, then we will send you an access code to the RQI One Stop to do your online class. And then you're going to Once you complete your online class, you go to one of our heart code mannequins or a VAM, a voice assisted mannequin. Once you complete your skills, you get your instant certification. For all healthcare providers, you get an online class, you get a free ebook, or the ebook's included, should I say. You get the skills check, and you get your instant certification that is American Heart approved. So don't be afraid to try it. CentralValleyCPRclasses.com. If you don't like that, then you can do our traditional classes at www.morethancpr.com. You can text us and email us, you can text us and call us at 559-765-0306, or you can email us at classinformation@morethancpr.com. So again, I hope that you support us. We're a small business. You know, me and Roberto, Miss Pat, all of our kids and stuff, we're here. We love you and we appreciate you. So don't forget, CentralValleyCPRclasses.com. So once you get the blood product from the blood bank, you should only take about 30 minutes to get it up and running. So if you can't get that blood product up and running within 30 minutes from the time that you get it from the blood bank, my question is, why the fuck did you get it from the blood bank? Stop going and wasting blood. Make sure you're prepared. But before you even try to get blood products, what's the first thing you should do? Consent. You have to have a consent for a patient. You can't just arbitrarily give people blood unless it's a medical emergency. But even in a medical emergency, you have to take into consideration that people may not want blood products. You know what I mean? So you have to think about that. If you can, you want to reach out to the family and you want to call the family and ask, hey, listen, your mom, your dad, your brother, sister, they need a blood transfusion. Can we provide that for them? Because it is a life-saving procedure that possibly they need this stuff. The problem is you can't always get a hold of the family. So what do we do if we can't get a hold of your family? Well, in strange cases, not strange cases, but in rare cases, some patients are Jehovah Witness or maybe some other type of religion, or maybe not religious at all, and they don't believe in getting blood transfused. But we'll go into that. But when we talk about blood transfusion, you don't want to take up to more than 4 hours. The speed of the transfusion is based upon the patient's age, weight, overall health, history, condition. For example, if a patient is in heart failure, the transfusion may be ran slowly to prevent the patient from receiving too much fluid all at once. You got to think about your patient. Don't just listen to the damn doctor and say, give that over 30 minutes. Well, hold on there, partner. What if the damn doctor's not making a sound decision? It's your job as a nurse to advocate for the patient. If they still want to continue down a road that you're not comfortable with, go to your charge nurse. If your charge nurse doesn't want to back you up, go to the house supervisor. If the house supervisor doesn't go up, contact your damn manager, charge your director at home. Wake their ass up there, nurse. Don't just say whatever because everybody's different. So during a blood transfusion, though, a doctor or nurse inserts a IV catheter into the vein. They slide the tube into the vein. They take out the needle. They throw the needle in the sharps container. And then they want to make sure that their IV's intact. Here's my biggest pet peeve with nurses is they always want to put an 18 gauge in people. Not everybody needs an 18 gauge. Most people don't need an 18 gauge. What does the Infusion Nurses Society say? The longer, the larger the catheter, the more increased risk for complications. Use the shortest, smallest cannula needed for the infusion therapy. Now, if you do have a smaller catheter because the patient's veins are collapsed or maybe they're tiny, you have to run the transfusion slower. Just don't run it over 4 hours. But it is recommended. It's not required. If you look at your damn policy, almost every policy says the same thing. It is recommended that you have a minimum of a 20 gauge IV, but it's not required, but it is recommended. So you got to be careful with that. Don't just blindly start giving people shit. All right. So when you do give blood products, you do need to get a consent. A patient should give consent before receiving blood components because we need to discuss the benefits, the risk, and any alternatives. Do you have things called epoetin, which can help increase red blood cells? Those are things like that. Maybe they don't need red blood cells. Maybe they need platelets and plasma. So those are some things that you want to discuss. So we have a lot of information that you can pay attention to. So if you have somebody that needs to get consent and they're not able to give you verbal consent or written consent because of their medical condition, 2 MDs can make that decision in a medical emergency. Here in California, I don't know if it's like this around the world or not, but I can't imagine it's not like this in the United States everywhere. if I'm able as a registered nurse to get the family, I can call the family in a medical emergency and say, hey, your mom, your dad, your brother, sister, they need a blood transfusion to save their life. Can we get consent? And once they say yes, then I get another RN. And once you have two RNs can sign the consent form. And then the doctor makes a note and we can consent them that way. So, informed consent or valid consent for transfusion is completed on all patients who will likely or definitely receive a transfusion of blood. These recommendations apply not only to packed red blood cells, but whole blood, red blood cells, platelets, plasma, fresh frozen plasma, cryoprecipitate. How you like that, Anna? Granulocytes, as well as those who are exposed to blood and blood components. Ooh, listen to that. As well as those who are exposed to blood and blood components. Maybe that's what I'll change my wording to maybe we should change that in the LV and scope of practice. So, blood components means epoetin, nutrient, those things that increase red blood cells or white blood cells. Patients who have been given blood transfusions and were not able to give informed consent and valid consent prior to transfusions are informed of the transfusion prior to discharge and provided with relevant paper or electronic information. So why wouldn't they be able to give consent? So maybe they have a medical issue that they can't. So for example, this lady here that we're going to talk about, she is a 44-year-old lady who's a Jehovah Witness who received blood transfusion during her treatment for necrotizing pancreatitis. That's another episode we'll talk about, necrotizing pancreatitis. So most Jehovah Witness, not all, there's different sects, and I don't mean SEX, but there's different sects, SECT. There's different sects that don't want any blood at all. There's some that want their own blood. There's some that will take blood. It just depends. Depends on what type of church they go to and if they will or will not accept blood. So, 44-year-old woman was admitted to the hospital for necrotizing pancreatitis. She had a significant blood loss and dropping of her hematocrit. With the severity of her condition, death was imminent. She was about to fucking die. Both the resident and the attending were aware that the patient was Jehovah's Witness. She had been intubated and was in the ICU, where she was told by the attending that he would not perform surgery without a blood transfusion and that without the surgery, she would definitely die. The insured attending felt the patient was competent when she nodded her head for consent for a blood transfusion. So that's key right there. Can a patient who was intubated give consent? He contacted the hospital's in-house counsel, who recommended doing whatever was medically necessary. The patient's husband had a written note from the wife stating, please don't let me die, gave oral permission for the blood transfusion. So the patient wrote a letter to her husband, says, quote, please don't let me die. The husband gave the attending and the resident oral permission to give the blood transfusion. After permission was obtained, the patient was taken to surgery, given blood transfusions, and over a 4-month hospitalization, spent 4 months in the hospital because she has necrotizing pancreatitis. Anyway, the patient went under more than 20 procedures and with more than 30 transfusions. Oh my God, she don't even have her own blood anymore. I wonder whose blood she's got coursing through her veins. I wonder if she was racist. Anyway, of course, guess what happened? Patient sued, filed a lawsuit against the surgeon, the resident, the institution, alleging that the transfusion of the blood products against her will was constituted battery. They batteried, how you like that, Anna? Her, and civil rights were violated. Prior to the trial, the institution was dropped from the suit. Oh, how come the institution was dropped and not the doctor and the resident? I bet one of the nurse was in there too. So the case went to trial where the jury found in favor of the physicians. What? How's that even possible? So if you're married and you give consent for treatment of your wife, that is considered consent. Whether you signed it or not, oral consent from a spouse who is married is most likely going to be considered in the eyes of the jury as given consent, whether you wanted it or not. If you don't want a medical procedure or blood products, you better tell your husband in writing or your wife in writing, you better put that shit in advance directive. Because if you tell me that you want me to do something, but you're not awake or you're not able to make consent, guess what the court is going to say? All right. So family members of the Jehovah Witness testified that the blood transfusion disregarded the patient's wishes. Generally, refusal of blood and blood product by a competent adult must be respected and may only be overridden by a court order in non-emergent situations. Involving the institution's legal counsel or medical ethics committee can help clarify the decision making during emergencies. If previously treated providers knew the patient's wishes about the blood transfusion, discussing and documentation of her preference could have been helpful in this emergency. They're saying you should chart shit people to help people in the next case so we all don't screw ourselves. Such a discussion should be considered for the patients with chronic conditions like necrotizing pancreatitis that may lead to emergency situations. Consent was obtained from the patient while she was intubated and sedated. That was her complaint, that the patient argued that the consent process should have taken before her intubation or that her sedation should have been lightened to enable her participation. So if possible, the consent discussion should be conducted before the patient undergoes procedures or drugs that limit her ability. I kind of disagree with this one because even if you lighten the sedation in court, somebody's going to say, well, she was still lightly sedated, so she can't really make consent. Anyway, they say non-spoken, non-written consent, such as nodding, should be carefully documented in a record with the names of identified witnesses. So if I say, hey, do you know your name? And you shake your head yes or no, and we all agree that you're competent and that you understood the question, not only should I document it, but other people should have documented it. But people don't think about these things in the rush of things because we're always rushing this shit. Based upon the note written by the patient to her husband gave permission for the blood transfusion. A mentally competent person, 18 years or older, has a right to consent to his or her own medical treatment and is the only person whose consent is valid. Consent given by a proxy should be documented, i.e. copy of the note should be added to the medical file. So if she wrote a note to the husband, don't let me die, which I'm sure that the husband showed to the physician, make a copy of the damn note, put it in the chart. So that way when you do get sued, you're like, listen, this lady said she didn't want to die. This patient was treated with multiple procedures and transfusion based upon a single act of consent. Generally, clinicians are not required to engage patients in an informed consent for each occurrence of a repetitive procedure or treatment. In other words, she has necrotizing pancreatitis. They're going to have to do multiple surgeries, multiple transfusions. You only need to get consent once, not keep giving. Now, if it's a different procedure, that's different. But these procedures were most likely all related to the same damn thing. However, when the initial consent occurs in the midst of an emergency and the treatment consented must be repeated during subsequent care, the consent process should be revisited and redocumented. I mean, that's just prudent. You don't want to sit here and make sure that you keep doing the same crazy stuff. So what do you think? How should nurses, doctors, physicians protect themselves in emergencies, especially in cases like this where people don't want to get blood products or kind of other things like that? They need to get consent for treatment. So let us know what you think. I think that when you do get blood transfusions, any kind of blood products, you need to be aware. I want you to know that here in the state of California, against all you RNs who think you know everything, LVNs, licensed vocational nurses, are able to transfuse blood and blood products as long as they receive their IV therapy and blood withdrawal certification. They can start IVs. They can give electrolytes, vitamins, nutrients, blood, and blood products, as long as it's not against hospital policy. So when we talk about blood transfusions, we need to make sure that we know what we're talking about so we don't harm our patients. We need to make sure we understand we use 0.9% sodium chloride. We need to make sure that we get a consent, either written is preferably. Doctors need to be involved, consenting those patients. Nurses shouldn't be doing it unless it's a medical emergency. We have no other choice. But there's no reason why two doctors can't medical consent to patients either. So, all right, nurses, let me know what you think. I appreciate you. I hope you enjoyed this episode, blood transfusion. We'll talk about it more as well as other medical issues. Thank you, guys. Peace. I love you. You bitches, I love you very much. Follow us at the transformationnurseacademy.com. I got a lot of resources. Go visit morethancpr.com, centralvalleycprclasses.com, morethanceus.com. We have education that we can provide you 24/7. All right, bitches, I love you. Have a great day.
Don't miss out. Engage with us weekly. Share your thoughts, and let's transform the nursing landscape together.